Okay, so now that you posted that, on to the physical exam. Patient had a general posture of rounded shoulders. The only functional screen I did was sit to stand. She'd been sitting for a while, so just seeing if she had any onset of symptoms, just doing that. That was unremarkable. And then I went on to the neurological screen, so cranial nerve exam, upper quarter neuro screen, and then upper motor neurons. So the Babinski I marked down as a negative. However, her response to it I thought was notable because she came into like a tight toe flexion, plantar flexion of her ankle, and then extension of her knee bilaterally, and it was almost difficult getting out of it. Like had to kind of shake her leg a little bit. So again, negative, but wanted to note that response in the notes. Clonus, 3 beats bilaterally. I did that on the ankles and the the hands. DTRs were diminished, and she said that she's always had a hard time. Physicians have always had a hard time finding her reflexes, and they've always been a little less um, than a normal. Hoffman's negative, Romberg, all the other ones, nothing significant there. The cranial nerve exam on the PowerPoint that is actually on Moodle. This chart is switched, so I'm sorry about that. This is how it should look, where right side is here, and then this is the left eye. So nothing significant other than the oculomotor, trochlear, and abducens. This was also kind of a dual test of smooth pursuit. So in each direction, she would get that not feeling right, and vision would blur, and you come back to the midline, and it would be okay. She still never came back to baseline of that not feeling good, but it wasn't as bad. And in each direction, all of the muscles worked. Her eyes tracked appropriately in all those directions, but on the right side, they just didn't move as far, which is I noted as decreased magnitude. She also had decreased hearing in her right ear on that exam. So moving on to the physical exam, nothing found with myotones or dermatones patterns. Cervical range of motion active. She moved her head right to left. Had no pain with that. Some symptoms of blurred vision and that dizziness or not feeling right started. And going into cervical extension, she said, "Whoa, I do not like that." And it was a little bit more dramatic dizziness and blurred vision. Now, I have dysarthria and dysphagia listed there, which is appropriate. That did happen. However, the way it presented at that time in the exam was not noticeable, and I'll explain that. So we had to revisit her response to that one later after we'd done more testing. So after the active, it's like, okay, well, you're dizzy, moving your head right to left, up, down. Let's do VOR. See if that does anything. So the VOR did produce dizziness. Cervical vestibular test did not. And when I moved her head, the modified VBI test was moving her head all the way to the right and holding it there. She started getting dizziness and kind of blinking her eyes, like, yep, that's like a more severe blurred vision. And then she started kind of slapping her tongue on the roof of her mouth as we came out of it. And I asked, do you have an itch, or are you having trouble swallowing? She said, yeah, I can't I couldn't really talk. I was having trouble swallowing. So that's where the dysarthria and dysphagia symptoms came in. And she said it was that happened over there, but not as bad. Meaning at this when she brought her head back, she also had that sensation of really not being able to produce sound or swallow, but it wasn't as um, noticeable to us or parent because she wasn't slapping her tongue. So then brought her to the left side. Coming out the left side, I noted nystagmus. So holding at the left, nothing, but coming out of it, nystagmus was beating to the right, about 2 beats. However, that was not reproducible. So I don't know if that was my own bias. I was looking for that, or what. I noted it, but couldn't reproduce it when I tried it again. So then we went supine. Said, okay, the modified VBI test looked positive. Let's see this test. And it actually did not reproduce any symptoms, any of the blurred vision. She was fine. However, her lower extremity, right leg, went in that extended and rotated position, went into this like spastic extension, similar to like a corticate or cerebral. Her upper extremity, not spastic. I mean, her elbow was flexed and her hand was kind of in a fist, but I don't know if it was there before the rotation happened. I just noticed when the leg moved and went into this very straight, boom, spastic. And I asked, is there pain? You know, sometimes it's a pain response, no pain. So that released, and she was able to move her foot when I took her out of that position. And just tracking up the neck, she had really severe tenderness on the C2 spinous process, so did not go any further with neck movement. Brought her up and said, let's try the modified sharp purser. She, just looking down, already had symptoms worsened with some compression, so stopped that, and couldn't even palpate the C2 spinous process in sitting to do the outer ligament instability. So that was the extent of the physical exam. We took a step back and started, I guess, assessing everything. So head on to Moodle based on that. Let me know what your hypotheses are and objective asterisks. Thank you. Any questions you have? Thanks.